Denny Johnson here, and this is a demonstration of how to use the Rayid system of birth order to identify the potential genetic and epigenetic influences on 3 different girls and their brother, 4 children in all, and how to be able to use this map to understand the body type and basic personality attributes of these 4 siblings. Now, I have no knowledge of these 4 siblings. I've not met them, but they actually do exist. Now, this is a demonstration about how to be able to use this without any other factors involved, such as how we would normally apply the iris of the eye as an indicator of both sides of the family tree, and so on. There's a wealth of information there. There is no family knowledge or medical history. With the medical history and the way the mother and the father interrelated to their own families, social family histories, loss, behavioral dysfunctions, alcoholism, all of the history that's possible. If we had all of that information, this would greatly enhance the detail of understanding the influences to these 4 children. Now, the 4 children, they are specifically related in this model to a specific diagram of how they are connected genetically to the family. Number 1 girl is connected primarily to the father's family, and usually it's the father's mother's line, and often it's the father's mother's genetic line. The second girl is related to the mother's line, and these two have distinctly different personality and body types. So the goal is to be able to identify the universal tendency for these different birth order positions to have different body types and personalities. For example, the number 1 girl usually has a more mentally grounded, practical, or assertive, mental, talkative type of mind that has a desire to control and usually likes to relate more to the father's side of the family. And there are many things about how this evolves over a lifetime. Later we will discuss how this sequence has a particular genetic sequence that now describes when they turn on specific parts of the family tree and how it affects their development, personality, hormones, and so on. Number 1 girl is usually more stocky in the body, sometimes a pear-shaped body, and usually slightly stronger in the bones. The second girl is usually smaller, oftentimes can be physically the smallest of the family tree. She's usually more thin and usually more independent in character. Oftentimes doesn't talk as much as her older sister, but certainly does not allow anyone, including her older sister, to control her. She usually is from the mother's side of the family, and she is oftentimes one who desires being left alone or loves her privacy, very independent, loves her own sense of liberty. This is the characteristic of a number 2. The third one actually is a combination because it is the first son. First, we recognize the position from the top. It's called third behind a girl first. That's called number 3. That 3 is a connection to the father's side of the family, and specifically the great-grandparents on the father's side. Now this takes on characteristics which begin to correspond to this part of the family tree. Keep in mind that these are also attributes of the left brain, right brain functions. So this child here has a tendency to grow up more capable of the mind, more desirous of social material things, the ability to be able to manage practical details with other people, business type manager, corporate executive, somebody who has a practical sense in the world. The fourth one is in an unusual position because it has multiple influences from different parts of the family. The influences, as the fourth behind a girl first, primarily takes on this blue line to the mother's side of the family, and this is a very yin type of person in many ways, including oftentimes this position is oftentimes one of the tallest or the second tallest of all of the children in the family. So this is oftentimes, out of the four, would have the greatest propensity for being most angular or thin of the body naturally. This is also in a position that's sometimes called the rebellious or the changer or the transmuter, one who does not follow the normal grid of the family and usually does not follow the normal grid of life. And this is an extraordinary person who likes to change something, who likes to discover what's new. They're not so much related into the things of the past, but usually like to develop something that is transformational. In this situation, it's also, in the gender position, it's the third daughter. Now this is another influence, and that's why there is a secondary line that goes up to a specific great-grandmother, which is the father's father's mother. And this has a specific paradigm where it now brings in force and solidness to the body. So this angular body now becomes more of a muscular type body. Now the third influence is the fact that it's behind a boy in this separated sequence. Because of this, this now has a second influence, which is to the position of the father's father, which is relative to the experience of fire or emotion or being driven. And when you combine these two together, the number 3 girl and the second behind a boy, you have a more active, physically capable, angular person, physically capable. So I sometimes call this pattern the pattern of the gazelle, because this is where it's angular, active, and muscular. This is also the place of the study of the plant kingdom. It's a place of service, it's a place of research, it's a place of herbalism, it's a place of medicine, it's a place of wisdom, it's a place of law, it's a place of the body, it's a place of yoga, it's a place of many things relative to the physical experience. But this is a very opposite kind of configuration. So part of this person is very much, this woman, is very much a part of the abstract and changeable and mutable, but also has two forces into the masculine. So this creates some degrees of extremes in the person's life. The brother is also a number 1 son, so he's primarily related to the mother's family and the father's family. He has 2 influences, but these are the 2 positions that provide a great deal of stability. The fourth one, well, might have a tumultuous existence in some form or another. The first one, oftentimes more stable. The second one, well, feeling-oriented, detached, separated, creative, or artistic in some way, but having the desire to be left alone or nobody violating their own right to choose for themselves. You could go through each one of these for an hour. Now, if you had the rest of the information about the family history, medical history, grandparents, if you had symptoms of the body, what age were traumatic events, what age did they break a bone, or was there a disease that occurred one time or another? If you had the information, you have a lot more potential for being able to describe what might also be arriving. Now, what's arriving is also looked at by what's a timeline map. This is a sequence that relates to the influences of the triangles are from the grandfathers, the blue ones from the mother's family, the red ones from the father's family, and these are what's called the ascending forces. The ascending forces of the masculine One side regulates the biochemistry, the metabolism of the body. Another one represents the ability to be able to move and represents the ascending forces of the fire and the blood and the heart and the ability to move and the central nervous system and brain. That's the ascending fire position. On this same side is what's called the descending yang position, which is the influences of the three grandmothers from the father's side, which regulates the experience of the immune system, the neuromuscular and the fascia, the ligaments, and also the digestive tract, the digestive, skeletal, and bones. So whenever there is a characteristic difficulty in either one of these birth order positions, we look at the ascending and descending forces, and we also look at the age that an event occurred. For example, if you have somebody who has a child who dies of a heart attack at age 12, where would that be in the map? What is it about the heart and the ascending issues? And you can pretty much begin a theoretic exploration of where the epigenetic influences might have come from to precipitate this tendency to aggravate a already existing genetic condition. So this is a basic introduction to how this can be used through the birth order. This is without any other the body signs or any of the social or family history. This is a very basic demonstration of how to do it. So those of you who are learning this is an example of how to use it on a very basic level. Come back again sometime and we'll show you how to do it with much more detail. Have a good day.